In 2020, the National Health Law Program, along with 4 other national organizations, began a project to monitor Medicaid experiences that were gathered directly from Medicaid applicants and enrollees. This project started on the belief that people with lived experiences have valuable insights to share with policymakers and state Medicaid officials about how crucial this program is and about the barriers that applicants face when trying to establish eligibility and access needed supports and services. It was designed to center the lived experiences of Black, Indigenous, and people of color and other underserved populations, including immigrant, LGBTQ+, and persons with disabilities, as well as underscore long-standing program issues that would resurface when states reinstated the Medicaid redetermination process after pandemic continuous coverage provisions ended. This Medicaid monitoring project began when a healthcare crisis was wreaking havoc on the nation. Medicaid advocates had already pushed back against the Trump administration's earlier attempts to undermine Medicaid by changing existing regulations, rescinding sub-regulatory guidance, and transforming Medicaid away from its open-ended funding stream. This assault on Medicaid was followed by the COVID-19 global pandemic, a health crisis that laid bare health disparities throughout the U.S.
Healthcare is another one that I could say that they have issues with that as well, because you're only limited to a certain amount of providers that actually take Medicaid in this area. And certain ones do and other ones don't. So the availability for Medicaid for me here is very limited than what it was when I was in the Atlanta area. Like I said earlier, it's slim to none as far as providers. And not only that, the wait list to see an actual provider. Like right now, I'm scheduled for my the yearly exam annual. He does not have availability until October.
And help leverage its health law partnerships currently established in some 23 states and identified 8 states to work with to recruit storytellers and to capture their authentic lived experiences. State partners use a variety of outreach methods to recruit people with Medicaid lived experience, like social media campaigns and printed flyers and mailings to community health centers and faith-based organizations. However, the most successful recruitment occurred when trusted messengers gained the trust of communities through respectful human interaction.
So why do we center the perspectives of Medicaid enrollees in healthcare advocacy? We do it because they anchor advocacy in the lived experiences of those who are most impacted by our work. When we center them, they hear and see themselves in our efforts. To be able to say as an advocate that I see you, I hear you, and for the community to feel seen and heard is a significant point of engagement. But by centering, we elevate the actual lived realities as opposed to elevating uninformed and outdated assumptions. Advocates are a 2-in-1. We work with individuals and we work with healthcare systems, and we can facilitate information between both, thus mitigating the immediate needs while moving upstream to change the future landscape.
The primary objective of the Medicaid Monitoring Project was to use Medicaid stories to direct administrative advocacy to improve Medicaid. State partners were already working with NHELP to challenge policies that weaken Medicaid, such as work requirements and the public charge rule. Medicaid monitoring allowed state advocates to develop advocacy priorities that were informed by the experiences of enrollees. Even more importantly, advocates began to help Medicaid enrollees to develop their own skills and expertise so that they could become skillful advocates for themselves. In 2025, a Republican trifecta is shaping the federal agenda. Legislative proposals to overhaul Medicaid, including block grants, per capita caps, work requirements, and other proposals to drastically cut funding and services, are regaining momentum. If enacted, these changes could severely undermine access to healthcare for millions of low-income individuals, families, and people with disabilities. Now, more than ever, we need to capture the breadth and the depth of the experiences of Medicaid enrollees. We need to hear, in their own words, why this crucial access to healthcare needs to be protected.